Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about obstructed labor. So go ahead, subscribe, and let's get started. All right, students, listen. Obstructed labor is when a woman is having good, strong contractions, but the baby is still not coming down. Normally, when contractions are strong, the baby should gradually move through the birth canal. But, in this case, something is blocking the way. It could be because the baby is too big, the mother's pelvis is too small, or the baby is in the wrong position. So even though the uterus is working well and pushing, the baby gets stuck, and there is no progress in labor. Next, we will discuss the causes of obstructed labor. Maternal causes of obstructed labor are problems from the mother's side that block the baby's way out. For example, if the pelvis is too small or narrow, the baby cannot pass through easily. Sometimes there may be growths like fibroids or ovarian cysts in the pelvis, which act like a physical blockage. Even a full bladder or rectum can press on the birth canal and slow down or stop the baby's descent. So basically, anything in the mother that reduces space in the birth passage can lead to obstruction. Now, let's look at fetal causes and passage issues. Fetal causes mean the problem is from the baby's side. Sometimes the baby is too big, which we call macrosomia, so it becomes difficult to pass through the birth canal. In some cases, the baby may have abnormalities like hydrocephalus, where the head is enlarged, making delivery difficult. Also, if the baby is not in the correct position, like facing upwards instead of down, occipito-posterior, or if the baby is in the wrong presentation like breech or transverse lie, it can block normal delivery. Now coming to passage issues, the most important one is cephalopelvic disproportion, or CPD. This means the baby's head is too big compared to the mother's pelvis, so it simply cannot fit through. So overall, either the baby is too big, in the wrong position, or the size doesn't match the pelvis. Now, let's understand the risk factors. Risk factors are things that increase the chance of obstructed labor. For example, early marriage and pregnancy can be a problem because the mother's body, especially the pelvis, may not be fully developed. Malnutrition also affects pelvic growth, making it smaller and less suitable for delivery. If a woman had a difficult labor before, there is a higher chance it can happen again. Lack of antenatal care means problems are not identified early, so complications can occur during labor. Also, short maternal height is often associated with a smaller pelvis, which can make it difficult for the baby to pass through. Let's understand pathophysiology of obstructed labor. In obstructed labor, the uterus keeps contracting strongly, trying to push the baby down, but the baby does not descend because something is blocking the way. As this continues, a line called Bandel's ring forms, which is a sign that the uterus is under too much stress. Over time, the uterus becomes very tired, and this can even lead to rupture, which is very dangerous. At the same time, the baby is not getting enough oxygen, leading to fetal distress, and if not treated quickly, it can result in the baby's death. Now, let's look at the clinical features, especially the mother's signs. In obstructed labor, the first thing we notice is prolonged labor, meaning labor goes on for many hours, but there is no progress. The mother will also have severe abdominal pain because the uterus is contracting continuously without success. As labor continues, the bladder may become distended, since the mother is unable to pass urine properly. Due to long labor, she may become dehydrated and her pulse rate increases, tachycardia. Finally, the mother becomes extremely tired and exhausted because her body has been working hard for a long time without any result. Now, let's understand the fetal signs. In obstructed labor, the first sign is that the baby is not coming down at all, even though labor is going on. This is called no descent of the presenting part. Because the baby is stuck, it may not get enough oxygen, leading to fetal distress, which we can see as abnormal fetal heart rate. Sometimes, the baby passes stool inside the uterus due to stress, which leads to meconium-stained liquor. So overall, the baby shows signs of distress because it is not able to progress normally. Now let's understand the complications. If obstructed labor is not managed properly, it can be very dangerous for both the mother and the baby. For the mother, continuous pressure and strong contractions can cause the uterus to tear, which we call uterine rupture. She may also have heavy bleeding after delivery, known as postpartum hemorrhage. Because labor is prolonged, there is a high risk of infection or sepsis. In some cases, prolonged pressure can damage tissues and lead to abnormal openings called fistulas, where urine or stool may leak uncontrollably. For the baby, the main problem is lack of oxygen. This can lead to birth asphyxia, brain damage, or even stillbirth if not treated in time. So overall, obstructed labor is a serious condition that needs quick intervention to prevent these complications. Let's understand diagnosis of obstructed labor. To diagnose obstructed labor, first we do a clinical examination, which includes checking the abdomen and doing a vaginal exam to see the baby's position and progress. Then we use a partograph, which is a chart used during labor. If it shows that labor is not progressing, it is a strong sign of obstruction. If available, an ultrasound can also help to confirm the baby's position, size, or any abnormalities. All right, class. Now let's understand the immediate management. When a case of obstructed labor comes, the first thing we do is admit the patient to the hospital immediately. Then, we start IV fluids to correct dehydration, because the mother is usually very tired and dehydrated. Next, we do catheterization to empty the bladder, which also helps reduce obstruction. At the same time, we continuously monitor the mother's vital signs and the baby's heart rate to make sure both are stable. So basically, first we stabilize the mother and closely monitor both mother and baby before proceeding to further treatment. Now let's understand the definitive management. Once we confirm obstructed labor, the main aim is to deliver the baby safely. The most common method is a cesarean section because it is the safest and quickest way when the baby cannot come out normally. In some selected cases, if it is safe and the situation allows, we can go for assisted vaginal delivery using instruments. But this is only done when conditions are favorable. If there is a serious complication, like uterine rupture, then an emergency surgery called laparotomy is done to save the mother's life. So overall, the goal is quick and safe delivery to prevent complications for both mother and baby. Now, let's understand nursing management. As nurses, our first role is to carefully monitor the mother and baby. We check the mother's vital signs like pulse, blood pressure, and temperature to see if she is stable. Then we assess uterine contractions to know how strong and frequent they are. At the same time, we must check the baby's heart rate regularly to make sure the baby is not in distress. Finally, we observe the progress of labor using a partograph, which helps us identify early if labor is not progressing normally. So overall, nursing assessment is all about continuous monitoring and early detection of problems. All right, class. Now let's understand the nursing interventions. In obstructed labor, our main goal is to support the mother and prepare for safe delivery. First, we maintain hydration by giving IV fluids because the mother is usually exhausted and dehydrated. Then we insert a urinary catheter to keep the bladder empty, which also helps reduce obstruction. If the baby or mother is in distress, we provide oxygen to improve oxygen supply. At the same time, we must prepare the patient for an emergency cesarean section, as this is often needed. And throughout all this, we maintain strict asepsis to prevent infection. So overall, nursing care focuses on stabilizing the mother, preventing complications, and getting ready for emergency delivery. Let's understand psychological care and monitoring. In obstructed labor, the mother is usually very anxious, scared, and exhausted. So as nurses, we must provide reassurance and emotional support, talk to her calmly, and make her feel safe. We should also explain all procedures clearly, so she understands what is happening and feels more confident. At the same time, we must be very alert and continuously monitor for complications like uterine rupture or signs of shock. Early identification is very important to save the mother and baby. So overall, along with physical care, emotional support, and close monitoring are equally important. All right, class. Finally, let's understand prevention of obstructed labor. Obstructed labor can often be prevented with proper care. First, Regular antenatal care helps us identify problems early. Good nutrition is important so that the mother's body, especially the pelvis, develops well. We should also focus on early detection of high-risk cases so they can be managed before complications occur. Institutional delivery is very important because trained professionals can handle emergencies. And using a partograph during labor helps us detect delay in progress early and take timely action. So overall, prevention is all about early care, proper monitoring, and timely intervention. That brings us to the end of today's session on obstructed labor. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content.